get started. So thank you everyone for joining us for our second live webinar. Today we are going to be celebrating Black History Month and focusing on the intersections of racism and trafficking. I did want to mention that we are recording today's webinar, just so you know. So you can go back and watch the webinar at any time on our website. You can access it through the GAHTS member portal. I've emailed you information about this, but I'll follow up with the specific link later today, as well as some of the handouts and slides from the panelists. We will have some time for Q&A and discussion at the end. I'm hoping for around 20 minutes or so. So I would suggest that you hold off on some of your questions until then, until after we hear from all of our panelists. However, you are free to use the chat box if you'd like throughout the webinar. But I do recommend holding off on most of your comments and questions till the end so we can focus on each presenter and topic at hand. I find that the chat box can be a little distracting, and so I just want to make sure that we are giving each presenter our full attention. So feel free to use the chat box if you would like. But again, we will have plenty of time for discussion at the end, and since we do have multiple panelists, we want to give them each our full attention. So with that being said, I will hand it over to our first panelist, Jessica Donohue-Dioh, and I will let her briefly introduce herself and then get into our webinar.
Thanks, Anna. And it's great to see everyone. Thanks for making time in the middle of the day on a Friday. It's nice to have an audience to talk to. As Anna mentioned, I am Jessica Donohue-Dioh, and I'm assuming everyone can hear me okay because I don't see any really confused faces at the moment. I'm a social worker and have worked in anti-human trafficking for about 15 years now, in a variety of capacities, direct services, program management, and more recently in research. And my research has been around prevention from the perspective of survivors. But for today, I combined some of my teaching over the last decade or so related to oppression, diversity, social justice, which has obvious ties to race and racism, with my experience and interest in human trafficking. So I'm going to share my screen with you here, and I think it will all go just fine. Everybody can see that all right? Great. So I'm going to keep things kind of brief, and I'm really addressing some of the foundations, looking at historical transatlantic slave trade, colonization, and the development of race and the ties into current human trafficking. And for today, particularly, a little bit more of a lean on sex trafficking. You'll hear me say throughout that there are great resources and other scholars who have done this work before me. I am not the sole source for this, so I really want to acknowledge the work of others that have done this work. And Anna's going to share some resources after the webinar, in which I'm sharing one of the articles that I really drew upon and a couple of additional resources. So I hope that you'll go to those initial sources as well, and not just look to me because other folks are doing this outside of our group as well. So I want to make sure I honor that and recognize that. All right, everybody can see everything and hear me, so we're good to go. Great. All right, so we're going to talk about racial formation real quickly, and then we're going to address antebellum slavery, some values, myths, and stereotypes that developed out of that. Talk about westward expansion and the demographics of who was impacted there. We will particularly talk about Latinas, women who identify as Latina, and then this piece of what we saw as sex objects turning into brides, and then we'll talk about some of the impacts of those. So you'll see the various different racial and ethnic categories come up through this discussion. This is a quote that I just wanted to start out with, and this is pulled from one of the contributors to the Smithsonian African American Museum, and really identifying that, as it says, the world got along without race for the overwhelming majority of its history, but the US has never been without it. And I think that's really important to just ground our conversation today when we talk about human trafficking, and from my presentation and my lens in the US context, recognizing that we have never been without race and racism within the context of the country we know today. So formation of race, this is always a fun conversation. We all know, hopefully, that race is a social construct, not a biological construct, but I do think it's important to at least establish that initially. And we see race really coming up first in the 1500s. And it was identified at that time as people that were closely related to one another initially. It wasn't until the 1600s that we started to see it used in the format that we have today, separating people based on phenotype and physical features and perceived physical features. That really closely aligned with European Enlightenment. And Enlightenment is a really maybe oxymoron of a word to describe this, right? Because during that time, it was perceived to be enlightened to understand the world in these very arbitrary and artificial categories, which became racialized, particularly in the context of the US and colonization here. So as European Enlightenment was going on, the European settlers and colonists in what we have today as the US took that to mean a new separation between white and African and Native or First Peoples, and particularly this evolution of whiteness that was once reserved for only very elite white women in Europe was now being applied to anyone of European ancestry within the United States context, and drawing a distinct line between what you can see there as savage Indians and subhuman Africans. And we started to see that in the mid to late 1600s. And as you know, as you all probably well know, that was solidified and codified in our laws throughout the history of this country. And I won't go into all of that today. So we'll first talk about antebellum slavery. And this is where we see, in the context of race, the predominant foundation of African-American, Black Americans, and the roots of that slavery and racism into human trafficking today. So the roots that we tie in for human trafficking and the transatlantic slave trade, I'm really going to focus a little bit later, as you can see, on this sort of early 1800s period, because this is when we really started to see the solidification of brutality and sexual violence amongst slave owners and enslaved Black women and girls. And I'll talk about men as well a little bit. But if you make these connections, if you look at these lines, right, we see purely economic gains, right, a financial gain with the forced procreation, the enslavement of Black women and girls' bodies, right? We also saw sexual assault being used against Black men as a means of subjugation, right? Coercion and force to get them to be and behave in subservient manners, to exploit more labor, right? We also saw Black women and girls directly sold for sex slavery, right? It was very thinly veiled at times. There's a great article that talks about fancy girls that were sold into sex slavery. And it was, again, very, very thinly veiled as the idea of a sex slave at that time. So a few of the values and myths and stereotypes that came out of this. So the first being the value of procreation, right? Because we all know that at that time, enslaved persons had a monetary value to them. They were inherited, they were passed on. You could take loans against a Black person's body if you were a slave owner. And so the forced procreation was quite literally a financial gain for slave owners. And that was particularly and specifically targeted to Black women and Black girls. We also saw this idea and construct of Puritan values, which heavily influenced the sexual assault and exploitation aspect of things, because within those Puritan values, it wasn't appropriate for white men to engage in any kind of sexual activity with their wives who were perceived and deemed to be ladies outside of procreation, right? And so that was the only role of that sexual activity. And so as we hear historically so many times and still today, thinking about this boys will be boys context, these white men who had these sexual urges that weren't allowed to be satisfied within their Puritan value system would then exploit and rape their Black slaves and enslaved women and girls. When we look at men and the enslavement of Black men and boys, they were also sexualized in their slavery and exploitation and labor. And they were seen as, once again, a means to an end for procreation, right? For gaining more capital, more financial wealth. They were stereotyped as bulls and stocks, which lead into the modern day stereotyping of over-sexualized and hypersexualized of Black men within our society. Black women, the stereotypes that came out of this period of time were seen as seductive, sexually insatiable, and entrapping, right? So the blame related to these Puritan values was purely placed on Black women and girls. And we see that stereotyping come forward in the names of Jezebels. And there's many more that have been added to that throughout history. When we talk about westward expansion, which was going on during this same time and overlapping with the antebellum slavery period that I was talking about, we saw the colonization, continued colonization of First Peoples and Indigenous people. And there was a different perspective taken from the European settlers at this time. And rather than enslavement, they saw an opportunity for assimilation and power and control over this demographic. We talk a lot about assimilation related to language, hair, clothing, boarding schools. But what we don't as often identify is the sexual violence that was state sanctioned in order to subjugate and subdue women and girls who were of Native or Indigenous ancestry. And this quite literally led to and fed into the whitening of that demographic, as well as the degradation of girls and women and normalization of sexual abuse by white men within their community. They were primed and they were encouraged into prostitution during this time. And when they didn't do that more willingly, they were met with sexual violence and sexual assault. And I have the citation of Butler 2015 there, and that's one of the articles that Anna's going to share with you all later. And it goes into a lot more detail and really great information. As we talk about demographics of Latino women, this also dates back throughout history, throughout colonization. And one of the things that I wanted to share and point out with you all today are the Costa paintings that hopefully some of you all are familiar with or you've seen in your different ventures. Costa paintings were typically paintings of various relationships between European colonists and settlers and Indigenous or Latino women, and they identified a racial hierarchy as what they did. They established a hierarchy based upon skin color, hair color, texture, eye color, phenotype of facial features, body types. And this is one of the first times that we really saw this introduction of a hierarchy within the racial formations that we were seeing during these times. Those who were lower on the hierarchy were also faced with sexual violence, and that's depicted throughout Costa paintings. You'll be able to see, if you look and research a little bit, examples of Costa paintings where, depending on what the woman looks like, sexual violence was expected at times, and also seen as a seductive nature coming from that Latino women within those contexts in those paintings. Now we'll talk a little bit about sex objects turned brides. And this is really referring to Asian women. And I know that's a really large umbrella. And I apologize for not going into further detail about various different Asian ethnicities and demographics and countries of origin, but I am going to keep it a little bit broad for today's conversation. So the first thing that we talk about and identify is Asian women, particularly from the Far East, being seen as, once again, a different demographic and an object of sexualization than were Black women and girls, Native and First Peoples, or Latino women. And this was related to the perception that Asian women were more subordinate, servile, and docile, willing to serve their men and willing to serve a man. In the late to mid 1800s, we saw Asian women being brought to the United States to serve the needs of US and Asian men who were working and continuing to build this country. They were brought for their services of sex to provide these men with comfort at times, which we see then transform a little later into, quite literally, the terminology and the era that we know of comfort women, which was predominantly focused abroad. As we sent troops and engaged in wars throughout the world, we brought in comfort women to provide for the sexual needs and services of these men. There was an interesting assimilation that happened with this demographic of moving from comfort women and Asian lovers to what were permitted as brides. And this was mostly attributed to the perception of being more subservient and being more able to control and assimilate, and as well, at times, being able to pass with whiteness. So we see a different process within that demographic group. So these are my last two slides here. All of this has led to discriminant impacts today, right? So Black girls and women are overrepresented in sex trafficking and sex work, as well as within Native and First Peoples communities. There are some studies that identify as many as 75% of Indigenous and First Peoples girls and women having sold sex in exchange for food, shelter, or drugs. Traffickers will openly share when interviewed that while white women might bring them more money, they run a lower risk by trafficking Black, Indigenous, or women of color, because they're still seen as a commodity and their bodies are still objectified and seen as less valued and lower on that racial hierarchy and further from that white womanhood and ladylike achievement that we still perpetuate in our society today. Some of the expansions of what this has looked like, several of the authors that I draw upon talk about how, although this has been racialized in the beginning, we create a slippery slope whenever we permit these objectifications and human rights violations within any society. And so although many of those initial efforts would have never expected or supported the objectification and exploitation of white girls, we see that today in ways that we didn't see historically. And so that's sort of this expansion and slippery slope of what happens when we permit human rights violations in this way. We also see that the exploitation of Latino women and girls has expanded to not just that of European colonizers, but from within their own community in the agricultural and migration sex trafficking rings that we've uncovered. These last two are a couple of links, and actually I'm realizing that no one's probably going to be able to click on them, but they are in the resources that Anna's sending out. So that is it. The first one there identifies some great demographics for you. And the second one with Frindon Hopkins is an article Tina Front is a sex trafficking survivor and a woman of color. And then Anna's also going to share an article with you, the Butler 2015 article, that I think will provide you a lot more context as well. I'll end with just a quote and a question for you to reflect on, not to answer right now. Race and racism involve violence, oppression, exploitation, and indignity. And so I ask us to think, how far is that definition removed from what constitutes human trafficking today? And you've got my email if you want to reach out to me. And I think I might be a little over time. I'm sorry, Anna.
No, you're fine. Thank you, Jessica, for going into the history and laying a good foundation for the webinar today. So I will now turn it over to Wendy Stiver. And Wendy, if you want to give a brief introduction of yourself and then go into your portion of the webinar.
Okay, thank you so much. My name is Wendy Stiver. I've been a registered nurse since 1981. Have worked in a variety of fields, and most recently have been working in nursing continuing professional development, which has led me into the study of human trafficking, because some states now require that nurses have continuing education content every 2 years in order to renew their licenses. And so that is how I have gotten into this field. I work as a nurse writer and nurse journalist to pull together texts for nurses, and have been published in the field of human trafficking, looking at it from a healthcare/nursing lens. I have no financial disclosures. And today I'm going to talk about implicit bias. And I believe my handout has circulated via email. This is a very low-tech presentation. And that's Bruno in the background, in case you wonder what you see moving. And I'm looking at this is what we don't know, what we don't know. And that can be dangerous, because first we need to get some terms straight as far as what is implicit bias. We all have biases. Some of us like the color blue, some of us like the color red, some of us are dog people, some of us are cat people. Those types of preferences and biases are usually not the ones that cause us problems when looking at the field of racism and how it infiltrates our society and our healthcare practices. Implicit bias is part of being human. I will quote extensively from Narayan, whose 2019 article has been extremely valuable. And she points out that to be human is to prefer familiar people. And there has been a lot of research looking at the power of the unconscious. And this is what we don't know about what we don't know, because we very often are not aware of what is living in our subconscious, so to speak. And some studies have shown that 80 to 90% of our mind works without conscious awareness. And let's think about that for a minute. If I'm not aware of how I'm categorizing and looking at people, then I may not be aware of how I'm treating a patient who is a person of color differently than a patient who is a Caucasian person. Implicit bias develops early in life. None of us are immune. And when you think about it, think of the things that you saw and heard in your early childhood. What language was used in reference to people of color or different ethnic groups? And we may not be aware that we still carry that with us. And that is what feeds into our implicit biases. Implicit bias is being explored in how it affects healthcare workers, how it affects law enforcement personnel, and teachers, educational systems, and it is a topic of current research. Implicit bias is rooted in heuristics. These are mental shortcuts that help us comprehend and respond to situations quickly. Such as, think about when a law enforcement officer encounters a person on the streets that may or may not have committed a crime. That officer is doing sort of automatic categorizations in their mind of how to respond to this situation and hopefully get home safely. Or what about when a nurse receives a potential trafficking victim / survivor in the emergency department? That nurse is often categorizing based on the appearance of the person, what the color of their skin, what language they speak, and a variety of other factors which may or may not be valid ways to look at that person. And it's important to realize that when we are stressed, we revert back to our implicit biases. We fall back on what our gut tells us, and our gut may be wrong. I know we've all been taught go with your gut, but sometimes our gut tells us wrong things. And we see what we look for. And study after study has documented this, that if we categorize a person of color one way, we will look at their medical presentation, their signs and symptoms, a specific way that fits with how we're categorizing them. Numerous studies have shown that most healthcare providers harbor implicit bias towards people of color. And when we think about the victims of domestic minor sex trafficking, for example, 22% of victims are usually white, 21% Hispanic Latino, 35% Black. And also we see a large percentage of Native American Indigenous people as trafficking victims / survivors. So if the healthcare provider who receives that person in the emergency room has an implicit bias towards people of color, how is that going to affect how that patient is treated? The effects of implicit biases are associated with negative effects in patient care, such as inadequate patient assessments. Providers often give inappropriate diagnoses and make treatment decisions based on the wrong diagnoses, spend less time involved in patient care, and patients are discharged from the emergency room or the hospital with insufficient follow-up. And think of how that's going to impact a trafficking survivor if they are given the wrong diagnosis, if the red flags are not seen correctly, and the provider just wants to get that person out of their emergency room. Think about law enforcement. A 2019 study showed that victims of human trafficking often do not trust the police and rarely seek assistance. Victims believe that police hold biases against them. And once again, if the people that we are all committed to helping do not trust those in a position to help them, what meaningful change can happen? Murray stated that global protests about racism and police brutality should act as a wake-up call to the anti-human trafficking movement over the approach of law enforcement, the treatment of Black victims, and a lack of racial diversity. And I would propose that the same caveat applies to healthcare workers, because if we are seeing in this era of COVID and in sort of the era of more protests, Black Lives Matter and similar movements, we are seeing that racism influences our culture perhaps more than we've been willing to admit. The discussion of, oh, got ahead of myself. Now, we also need to think about explicit bias. This is what we're aware of. For example, I really don't like certain types of foods. That is my explicit bias. That this is where the person is aware of their prejudices, positive or negative, and this is where you will see racist comments and misogynist comments and other things that that person is aware of. The discussion of disparities in healthcare is not new. In 2003, the Institute of Medicine published a classic work, Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare. And they showed that there are disparate outcomes associated with age, sex, religion, socioeconomic status, sexual orientation, gender identification, disability, and stigmatized diagnoses such as HIV or obesity, mental illness, or substance use disorders. Now, once again, let's tie this to the human trafficking victims / survivors we see in our clinics, our ERs, in our high schools, and in the streets. These are often people of color, most predominantly women and girls, usually poor, LGBTQI, have a history of trauma, a history of mental illness, and a history of substance use disorder. Do we see each person as a unique individual, or do we categorize them and act upon our biases? Those of us who have worked in hospitals are well aware of the Joint Commission, which is a regulatory agency, and they published a very valuable quick safety bulletin on implicit bias in healthcare back in 2016. And it recommended a variety of things that healthcare institutions should do to try and reduce the effect of implicit bias. Oh, and I will state, if you hear a little tap, tap, tapping at the chamber door and chirping, there is a bird that's trying to get in my window. Don't know why, but it is. And once again, the COVID-19 pandemic is shining a light on these inequities, because we're seeing that people of color are getting sicker and dying more, due in large part to inadequate and unequal care. Now, what can one person do? Obviously, in this audience, I'm sort of preaching to the choir. We are highly educated. We work in the fields of human trafficking, but we still don't know what we don't know until we measure it. Sort of the gold standard from what I've seen of how to look at our own biases is the IAT, Implicit Association Test. This tests for implicit bias related to 14 features such as race, disability, weight, gender in relation to careers, etc. And I put the link in your handouts. It's on the Harvard EDU website. And the way it works is you take a test, it takes about 10-15 minutes, and it measures the strength of associations between concepts and evaluations of stereotypes. Now, I thought, okay, I'm going to take a couple of these so I can report back on my experience. And I thought, I'm a Californian, I'm politically liberal, I'm highly educated, I'm disabled myself. Surely I have no implicit biases. Once again, you don't know what you don't know until you measure it. And I found that I do have some implicit biases in regards to race, and I was horrified. I was shocked. But once again, this is the value of this test. It helps us look at ourselves, look at what our minds are categorizing and thinking without our knowledge or consent, so to speak. Another resource is the Kirwan Institute, which is out of Ohio State, has some wonderful videos on implicit bias. They're free, they're available online. And there are numbers of articles and other resources, which if you want, just email me and I will send you the information. Now, once you know what you don't know, how do you address your implicit biases? Once again, turning to Narayan's article, she discusses self-interventions to mitigate implicit bias, such as counter stereotypic imaging, sort of countering our stereotypical pictures in our mind with an opposite or a more positive image to try and help us reframe how we look at things. Emotional regulations, controlling thoughts and emotions during clinical encounters, or whether it be in the emergency room, the clinic, or law enforcement encounters. How do we control our emotions and how we are emotionally reacting to the situation? Habit replacement. Now, this is not a one and done. The habit of unbiased thinking needs to be practiced consistently and consciously and over time so we can change biases that were probably laid down when we were little kids. Increasing opportunities for contact. This is why if I get to know a person from a different group than I am as an individual, then I am less apt to stereotype about them. Individuation, listen and learn the patient's story. Take the time to discover who they are as an individual. Mindfulness plays an important role in dealing with our implicit biases. The stop technique, basically just stop what you're doing, take some deep breaths, observe yourself, observe your reactions, and sort of figure, okay, now that I've calmed myself down, sort of de-escalated my inner angst, how can I best help this person? Partnership building, working with the patient as an equal, and taking the perspective of the other person. We can do this through reading literature, through listening to trafficking survivors tell their stories, and also stereotype replacement. In several sources, I saw them like using examples such as Oprah. Everybody loves Oprah. So use Oprah as a stereotype of a woman of color rather than, whoever else we previously held in our minds. Now, you'll see on your handout mentioning Google. This is the company Google that does all the whatever it is that they do that we all rely upon. And they have developed what they call unbiasing. And this is their corporate approach to mitigating unconscious bias and teaching their employees to give their first thoughts a second look. Now, how are we doing for time, Anna?
We are at about time. So if we have time at the end, maybe we could come back.
Okay, yeah, because I do have a scenario that I could read about a clinical situation that is good for discussion. But for now, I just wanted to say that this is obviously just the tip of a very large iceberg. But my goal for today was to help us all realize that we don't know what our implicit biases are until we quantify them and use the data about ourselves to make individual changes that can then change practice and improve our practice settings, whether it be healthcare, law enforcement, social work, teaching, to best serve and meet the needs of the human trafficking victim and survivor. Thank you so much for your time and attention. It was a great honor to present to this group.
Thank you, Wendy, and for giving us the healthcare perspective. And if we do have time later, we can come back to that scenario. And but I'm going to hand it over to David. So we'll be switching from healthcare and transitioning into more of a public health look at this. So David, I will let you take it away.
Thank you very much. It's a very great pleasure to I need to be able to share my screen.
Oh, yes.
Very great pleasure to present.
Sorry.
Thank you very much.
Okay, you should be good now. Sorry about that.
We're good. Here's the deck. And get the slideshow. So a little bit of background on myself. We are going to be using something called a meta-analysis. This is a statistical approach. My organization, Peacework, does statistical analyses for in issue-driven advocacy. Human trafficking is a major initiative. We do a few other things. We'll talk about that in just a moment. We're going to be looking at racial bias and risk factors for human trafficking in the United States. As Anna said, we're going to be taking a public health approach. We're going to be looking at a wide-scale demographics, and we're going to be using outcome from Polaris, counted by state, look at state level demographics and see what the intersection is, see what the connection is to identify drivers for human trafficking, the risk factors for victims for human trafficking today. A bit first about the organization. We are Peacework. We are an all-volunteer organization. We are statistical analysts. We do volunteer statistical causes. These are pro bono studies. Just as attorneys may take pro bono cases, we're statisticians. We take pro bono cases too. You can see we do a number of different things, but for a number of years now, for going on 10 years now, 9 years, it's been that human trafficking has been a major initiative at Peacework. So I think we're all familiar with Polaris. Not sure everyone has seen some of the data they have available. Not only do they have, of course, they manage the hotline. They also make information available for researchers, for teachers, for a number of people. A lot of very, very useful information. This study has been based on collecting data at a state level from Polaris. So these are the outcomes. These are the number of victims. Now, when we look at this, we're going to see victims and survivors identified, high indicators, moderate indicators, and other things. So Polaris in their call center, they get many, many different kinds of calls. Some of the people are simply calling for information. I've called them a couple of times myself. Do you have this particular resource? It isn't only a reporting of victims. And so they rate the number of people by indicators. There's people that have high indicators that this person really was a victim. They have people with moderate indicators, maybe information is complete or they're just not sure. And then you have completely unrelated calls. They are not from victims. So in this particular study, we've used to find out what the risk factors are. We've worked on we've worked with the report from Polaris from 2012 and forward, and we're looking at that the high indicator subpopulation. So it's a group of people where it's not that we're disregarding all the others, but we want to be sure that the people we use to identify the risk factors, we want to be sure that those people are victims and survivors. Now, when you look at Polaris, you don't have data download. So it was necessary to go state by state for year after year and collect all the individual data. But now that I've got that data downloaded, it's available for other folks. If other people want to see summary data at a detailed level, Polaris doesn't support the data download, but we've got this information. It's available. They don't have predictive analytics. It's not their mission statement. Predictive analytics is something that Piecework does. And so we use the data which we've harvested from the Polaris website, publicly available, but not available for download. We put it into an analytic data set and done the predictive analytics. So meta-analysis. You may not be familiar with the term. We developed a statistical model that predicts the number of people that Polaris captured as a victim. You may not be familiar with the term meta-analysis, but we're all familiar with the process. This is something that's used quite a great deal in research, and we see situations where this has come up. The term may be unfamiliar, but meta-analysis is a process that combines studies from many different sources. We have multiple studies. It's a statistical process to combine all of those into a single study. So for example, if you ever heard of a super study on, well, some have just been coming out, the COVID-19 pandemic. You get studies from vaccines and their effectiveness. You have the same vaccines, but they've been tested in a number of different countries. So we have multiple studies on the same vaccines done in different places, and they're all very slightly different, but it's possible to combine all of those studies into a single super study. The technical term for this in statistics is meta-analysis. Meta-analysis is used for other things, but we use meta-analysis to combine multiple studies into a single study. Now, when we look at the individual states, they all have their own reporting mechanisms. They all have their own legal environment. They all have different variations in how they get the word out about the call center and how much resources are available to promote finding out about the call center and getting the information to people. And so every state is a little different in its reporting. Now, we know human trafficking is very, very underreported. So the degree of underreporting varies from state to state. Meta-analysis sets aside that factor. It looks at the different components and takes into account that there will be some differences in underreporting. It allows all the states to be combined together so that reporting level is put into one category, and the drivers, which happen from state to state, they're going to be consistent across different states. So we look at 50 states in the District of Columbia. We've got a graph on the left. We have a graph on the right. Without the District of Columbia in the graph on the left is the point way above the rest, and on the right, there's a lot of human trafficking reported coming from the District of Columbia. And so we've evaluated our models, but we noticed something pretty early on when we did the analysis. When we looked at the location, when we created this is a number of victims per capita. Now, this is something that you're not going to get from the Polaris data. It's produced in the Piecework research and others. One of the things you'll often hear, and I think it perpetuates a real misconception about human trafficking. What's the biggest state for human trafficking? California. Wrong. California has more victims, but also has more people. If you want to look at the places where there is the most human trafficking, you really need to look at it per capita. So we're looking at victim per capita since 2007 at a state level. And it turns out that Washington, D.C., as we mentioned before, is at the top, and various other states with various numbers. It's critically important when we do analysis in a rigorous, analytic fashion, we're using statistical best practices. We're not going to use the counts. We're going to use the counts per capita. So in this case, the numbers you're seeing are counts per million, number of confirmed Polaris confirmed victim reports divided by the population. That's going to guide us as to what the risk factors are. So when we look at the number per capita, we can also look at the demographics, financial situation, and other factors in each state. And it gives us guidance as to where we find more of this, we find more human trafficking as well. When we look at the states, one thing becomes quickly apparent, that the great majority, all of the states at the top, have a history of legal slavery. Now, as you look through this list, you see Hawaii and Nevada. Hawaii and Nevada both had legal slavery in 1860. Nevada wasn't a state, wasn't even a separate territory as part of the Utah Territory, but the Utah Territory had legal slavery just like the South. The Utah Territory, including Nevada, had legal slavery until emancipation at 1860. Of course, when we're looking at emancipation, we're going to remember that Hawaii in the mid-1800s, it was an independent country way out in the middle of the Pacific. It was later, they voted to become part of the United States, but just like, for example, we all remember Texas was for a little while an independent country and joined the United States. Well, Vermont was too, and so was Hawaii. A number of what are now states were once independent countries. Hawaii was an independent country until it joined the United States, and it had legal slavery. It had to abolish slavery when it joined the United States, even as territory, many years before it became a state. But see, Hawaii abolished legal slavery when it became part of the United States as a territory in the late 1880s. And so when we look at the top 8 states, every last one has a history of legal slavery. And there's some others. You got South Carolina, Maryland down here, but it begins to get mixed. You got California, Wyoming, you've got some former slave states, some not. But every one of the top states have a history of legal slavery. So what happened to the statistical model, which you just saw before, what happened to the statistical model is we were able to get a better analysis by separating the historical free states from the historical slave states. Race and a history of slavery played that much of a problem. So we split the model in two. We did separate analytic models. One model for the historical free states, one model for the historical slave states, including a couple of places that hadn't become states yet. But when you look at Oregon and so on, all the places that were territories at the time that later became part of the United States, we looked at them by whether or not they had legal slavery at emancipation. We can count the number of slaves. They were counted in 1860 on the 1860 census. And so we know the percent per capita slavery. Some states had legal slavery, but it was fairly rare. Delaware had legal slavery and it was almost unheard of there. Whereas other places, generally speaking, for the South you went, it's the origin of the phrase sold down the river, as in the Ohio or Mississippi River, where you went to further south where slavery was more entrenched and the treatment of slaves was even worse. And so we split the model into two to make two separate models, one for the historical free states, one for the historical slave states, and they've got different drivers. There are different things that go into them. Let's look at those. So when we look at just the slave states, you look on the right, yes, the model actually works. That's always nice to know. When we look at the drivers, these are the things that were found to be the things that happened the most in those states that had the most slavery. So when slavery went up, these numbers went up. When these numbers went up, slavery went up. Look at the factors. We've got per capita income. We have poverty. We know that these are our factors now. One interesting thing to comment on, you can find very, very few things in public health studies that correlate to both affluence and poverty. Generally speaking, when you get poverty, you get an increased number of all kinds of things. But human trafficking is also linked to per capita income. It's also linked to affluence. So what we're seeing in this statistical analysis is that human trafficking, well, think about how it functions as a business. It's a terrible crime, but it functions as an economic entity. And seeing it track with per capita income, this is really important because it teaches us to understand better human trafficking as an economic crime, and that when all businesses get better for whatever reason, you're tracking the stock market, you're looking at the GDP, you're listening to 6 o'clock news and the economy is up, the economy is down, remember that human trafficking tracks with the strength of the economy. it's still a business. And the things that drive businesses to have more customers impacts human trafficking as well. To make human trafficking thrive as a business, as an economic entity, it needs both poor victims and rich perpetrators. And so this is one of the very, very rare things you will find that correlates to both affluence and poverty. We also see percentage of slavery in the 1860s. Yes, folks, after you get through the economic factors, you look at slave states, the percentage of people legally enslaved at emancipation in 1860, the percent legally enslaved then is a predictor of the per capita level of human trafficking today. This is the most outstanding outcome for the particular statistical analysis. What it shows is, and we've been hearing about this, here are the numbers that go along with it, history of slavery is a factor. We see this as a sociological factor. If there's a predisposition, if we don't look into people's businesses, we'll look at that in more detail in just a moment. If people tend to look the other way in slavery, when people are able to hide slavery and the government doesn't come looking, we see a higher level of slavery today where there was a higher level of slavery at emancipation. Look at the 1860 census. It's a predictor. We also see Gini index. Gini index is a measurement of economic disparity. Here we know that Gini is a factor, but we've already taken into account when we've got per capita income and poverty. The Gini index, named after the Italian mathematician Gini, so it's a name, it's not an acronym. The Gini index measures, well, properly speaking, measures the dispersion of any number. And, you know, if you've got good baseball players and bad baseball players, you can calculate a Gini index on their your batting average. It's simply a measure of how stretched apart the numbers are. But usually Gini is applied to economic disparity. If the difference between the haves and the have-nots is really big, you get a bigger Gini index, and it's smaller. So here we're looking at how fast that changes. This is a driver of gentrification. It's tied in with housing insecurity. It's tied with aggravating that gap between the rich and the poor, which we see as a driver of human trafficking. We see as one of the weaker factors, but is definitely there. The Gini index, how much it changed, an increase in economic disparity leads to an increase in human trafficking. So when we hear about the haves and have-nots, the 1% and the 90% getting further apart, this is a driver of human trafficking identified in this study. Let's look at the free states. These are historical free states. We see foreclosure, that's a tracer. There are a lot of things around housing insecurity. We see, I'm going to skip over one, we see poverty, we see per capita income, we see race. Of course, in the days of legal slavery, it was persons of color who were enslaved. So that is a racial factor. We see race as an important factor here. We also see the thing that drops out of the percent in slavery, what instead we see this sociological factor. We see this right to work state. It turns out that states that choose, and states can choose to do what they want to do, and states are going to choose differently. States that choose to have a minimal amount of regulation of business, expect businesses to just police themselves. I don't know if that's ever worked out well, but if they expect businesses to police themselves, then one of the things they'll do is make their state a right to work state. So right to work state becomes an indicator, a tracer. It's like sticking a thermometer in a sick person. That thermometer isn't counting a blood serum level of some germ. It's counting temperature, but temperature goes up when the germ goes up. It's a tracer. It reflects. Here, right to work states, the degree of right to work laws reflect the regulatory environment in those states. States that are hands off on businesses tend to be ones where, taking everything else into account, they have more level of human trafficking. It helps create an environment where human trafficking can thrive as a business. And states can choose to do their regulations anywhere they want, but they need to be aware that when you choose to have a right to work state, when you choose to have a minimal regulatory environment, it can create an environment where human trafficking thrives. Create that state level task force. create that task force. Now, when we look at these factors, some of them may not have race on the label. It's not counting people by race, but we're looking at things that are racially linked, like poverty and the difference between the rich and the poor. So now that we have these statistical models, we have an understanding, and the models actually work. We've tested them. Okay, fine. We've done the math right. What do we get out of that? So here are a summary of the risk factors. One of the things I'm going to go through these pretty quickly. We reviewed them in detail before, but this time let's think about how they're racially linked. Obviously, legal history of slavery and race itself, but affluence and poverty. We know that poverty is linked to race, but we also know that increasing affluence often leaves persons of color behind. So this is a racially linked situation. We look at homelessness and housing insecurity. That's racially linked as well. What we're seeing, since race is in the model, what we're seeing is that over and above economics, that race is a factor even after you take economics into account. We know that there's history of legal slavery. We know that the race itself, simply counting the number of people, if you're a state with similar economics, but it's a higher number of persons of color, we're going to have a higher per capita reporting to the National Call Center of human trafficking victims. When we get into the Gini index, again, that's the difference between the rich and the poor. The further those get apart, well, now we're talking about persons of color as well. So when we dig into the actual risk factors, what we're seeing are risk factors that in most, not in every case, in many cases, the known risk factors for slavery are things that are linked to race in some fashion. So race becomes a very, very important driver, and there's a great deal of disparate impact. You know, there's another area where we've seen racially connected disparate impact, and it turns out that those problems are linked. When we look at the COVID-19 pandemic, we know there's been a dramatic racial disparate impact. We see that that is also true for human trafficking, because COVID-19 has changed the economy, and because the economy is linked to human trafficking and race is part of that connection. The COVID-19 pandemic has made human trafficking worse. So let's look at the COVID-19 factors. These are factors that are known to be predictors of things that are affected by COVID-19. COVID-19 has made these things worse. COVID-19 has obviously increases poverty, but the people who are very, very wealthy throughout the pandemic, they've largely been unaffected. There was a drop initially in stocks. They recently came back. If you look at the S&P 500, you look at the Dow Jones Industrial Average, you look at interest rates, you look at all the key factors for people who are running businesses or simply are very, very wealthy, they're actually doing better now, have been for several months, than before the pandemic began. During the pandemic, the rich have gotten richer and the poor have gotten poorer. And now look at that, Gini percent change. The difference between the rich and the poor has gotten further apart. That's a driver of human trafficking. Because of that, COVID-19 is a driver of human trafficking. COVID-19 has been, especially recently, has been increasing housing insecurity. That's another driver of human trafficking. So when we look at all the effects of human trafficking and the effects of COVID-19, COVID-19 has made things worse. And the racial disparity is at the core of that. So we can use statistical analysis, not only to find risk factors for human trafficking, we can also use statistical analysis to look at the places where COVID-19 has made trafficking worse. And the link between the two are the economics of race. So let's give a summary of what we've looked at today. Race is a factor. Even after we take economic factors into account and neutralize everything for them, over and above that, race is still a driver of human trafficking. Statistical analysis has confirmed the effect of the history of slavery. Where there have been legal slavery in the past, and also not just that it was slavery, yes or no, but the degree of slavery, the percentage of people legally enslaved in 1860 is a predictor of the percentage of human trafficking reported victims today. Recently, the COVID-19 pandemic has exacerbated these effects. We very often see this. Right now, the crisis of the moment is COVID-19. But when there are impacts, when there are crises that happen in our country and around the world, one of the things we're going to see consistently, one, Black folks get hurt worse. Native Americans often hurt much worse. So you look at the effects of the pandemic on human trafficking, it tells us where human trafficking has gotten worse. It's gotten worse where these racial factors are in effect. It's gotten worse in poor urban centers. It's gotten worse on Indian reservations. It's gotten worse in the COVID-19 has had the greatest effect where race plays a greater role in driving human trafficking victims. References? Some time for questions.
Thank you, David. And we will hold off to the end for questions.
Okay.
I appreciate that. And just noting on the COVID-19, as I know Wendy had mentioned that our March webinar will be focusing on the impacts of COVID-19 on research and human trafficking. And David will be presenting more of his research on that. So make sure
all that in detail. This was just flagging COVID-19 has a racial connection.
Yes.
And that drives human trafficking. So that was mentioned today.
Yes, yes. Thank you, David. So with that, I'm going to hand it over to our final panelist today, Charles. So if you would like to introduce yourself and finish us off today. Charles, I think you still might be muted.
Right.
Okay,
Sorry
there we go.
Sorry about that. Yeah.
No, you're fine.
Okay. Yeah, I'm Charles Hounmenou, assistant professor at Jane Addams College of Social Work. That is at the University of Illinois at Chicago. I have been in the field of human trafficking for more than 10 years now. Yeah, I conducted research on human trafficking in the US and in sub-Saharan Africa. Okay, that's what I can say about myself. And a little bit also, my English is my second language. I speak my native language, or my official language is French. So you might notice that in the way I talk. Okay, so today, I plan to talk a little bit, just a little bit, because I think we are running out of time, about the issue of racial bias in the federal prosecutions of human trafficking suspects. So I will try to do my best to present the information so that we can get what is more important. So I plan to discuss the basic racial demographics of people who were prosecuted in human trafficking cases in federal courts from 2001 to 2019. Okay, I will briefly analyze issues of bias. Okay, in the way statistics on race are given about the suspects in court reports and in the media. Also try to explain how and why Black men are disproportionately prosecuted for human trafficking instead of white men and so on, who represent actually the majority of perpetrators of human trafficking. And my presentation is based on federal reports only, nothing about states. So we know, based on the presentations given wonderfully by the first three people, they really show that human trafficking is highly connected to race and issues of vulnerability and so on, which is true. And you know, sometimes when you are in a vulnerable position and you don't have people to talk for you, or you don't have a voice to talk, people will treat you either as victim or criminals. And when we take the Blacks, Latino, and Natives, they are not yet in a position to present the reality of things happening to them. I can tell you that in most reports, research, or anything, most of the time, 6 out of 10 suspects of human trafficking are viewed as, they see them, the 6 out of 10 are Black. Say, okay, any case, any report of trafficking, who are the traffickers? Mostly Black, 60%, 70%, and so on. So this has been a trend for a long time. And we see that recently there have been some change, some shift. So I'm going to talk about that briefly. So let me start right away. Okay, so from 2001 to 2005, based on information received from U.S. Human trafficking reporting system, we have, the first cases of suspects who were prosecuted. But at that time, there was no report about race or ethnicity. And from 2007 to 2008, you can also see here that even though there were reports about issue of human trafficking in the US, you notice that from there, you can see that Blacks and Hispanic had the highest level of representation. You can see when you look at all suspects from 2007, 2008, you see that Blacks represent 36%, Hispanic 31%. So that was, you'll see that trend in what I'm gonna show for a while before we see the shift. And when we look also, even when we look at sex trafficking suspects, you notice that Blacks here have 44% and Hispanic 29%. So I want us to remember those statistics about the sex trafficking suspects. That can be helpful. Also, more important, the statistics about child sex trafficking suspects. You see, it's like Blacks here it's out of 10, you have 5 Blacks who were the suspects. That's what statistics show. Now, here we have this confirmed. When I say confirmed, I mean cases which people have found proof for and which actually had been, they have witnesses which confirmed, and there were reports of police to prove and to support that. So based on the confirmed cases also, we can see that it shows a similar trend. Blacks here, 33%, and what you can see here, the confirmed case, Hispanic have 39% of all cases of trafficking. And when it comes to sex trafficking suspects, Hispanic and Black represent 80%, those two races, 80% of all sex trafficking suspects. Now, I move to characteristics of suspected human trafficking incidents, 2008 to 2010. Okay, the trend here continues. You can see, based on race and ethnicity, Blacks are in greater number You have here 224. Hispanic come second, and you see blacks, altogether 24 blacks are here traffickers, which is striking. Now, I get to 2015. So, I wonder if it was some type of magic. How did we go from 10% of white, and suddenly we have 57% of white who have been identified in the reports from FBI and the federal prosecutors? You know, now we have 24% of blacks as traffickers and 57% of white. So I was talking about here. Here we're here, and look at what we see between 2008 and 2010. And suddenly, when we get here, you know, the difference is striking. It's more than double what Black people are. So there should be an explanation about that. And I think we have time to talk about that. So clearly, there is either something we cannot explain, or there is high bias in the reporting of the race of suspects of sex trafficking. Even at the state level, when you look at the state level, you'll also notice that most reports actually show that, you know, white people represent the highest level. For example, if I look at some statistics in King County in Washington, it was found that 80% of sex buyers, you know, are white men. That study was conducted by Ritchie, 2017, recently. And thinking also about a study of one of us, I think Lauren Martin, she conducted that in Minnesota, a 2017 study in Minnesota, found that the majority of buyers in the state are white, middle to upper class, and married men. So at the state level, we have those statistics, but at the federal level, it's another problem. Now, there is a paradox here. I don't know if you are familiar with the Human Trafficking Institute. It's based in, I think, Virginia. They have published 3 reports already. 2017, human trafficking federal report, I think, human trafficking report of federal level, 2017, 18, and 19. What I found as bizarre for that institute, which based its reports on federal cases, in all the 3 reports they published, I have a picture of the last one, they consistently said the report does not further detail race, ethnicity, or nationality information for defendant due to data limitation, which was not, this claim is not founded. And then they said, publicly available sources and court documents did not provide sufficient information about defendant's race and ethnicity, national origin to distill any meaningful data. That one too, I can challenge that, because when we look at what I just saw before this, the difference was clear. There was something about race, but they did not want to use that. Now, here, talking about CSEC, what is commercial cases or prosecuted cases of commercial sexual exploitation of children, we can see the difference clearly. For example, the federal report, federal prosecution of CSEC offenders in 2006, as you can see there, white represent 76% of all cases, while you can see blacks only 5%. So the problem is, how do we explain that? How do we understand the shift? Here now, moving on. 2004, talking about CSEC cases from 2004 to 2013. Here I'm talking about at least 37,000 prosecuted cases of CSEC. Of course, here I have to stop and say that for the law enforcement, for the criminal justice, they take into account the full definition of CSEC, which is not only sex trafficking or commercial sexual exploitation on the street. They focus also on child pornography, production, use, or transportation of child pornography. All these are part of CSEC, but most of the time in our world of researchers, we mostly focus on cases on the street. But FBI, DOJ, they take all these cases into account. And also, Department of Justice, they have enough resources to really investigate cases of pornography, child pornography. And as this table shows, child pornography actually it takes most of the cases. I will say, as you can see there, child pornography production is 80% white. Child pornography possession, white, you see, and compare that to the other races. You see, white, black, it is striking. I'm gonna pull this again. So, the issue here is that when we talk about profile of investigative charges or convicted people for CSEC, you'll see that 92% of cases which were investigated, charged, or convicted for CSEC were white. And what is particular about this figure I'm showing you is that it's about CSEC suspects who were in high-profile leadership position in the US. This chart, this figure is based on 218 cases which were actually mostly available online, but you need to know where to find them. And someone did a great job pulling all this information together to show. And what is surprising is that out of those 218 high-profile leaders, most of them are in higher education. Then the problem is sometimes when people who are suspects of CSEC are in high position, we avoid talking about them because that is a hot, I would say, hot button. We don't talk about that, and it continues. And something I want to show here now is that prosecution of sex trafficking of children is down nationwide. Look at the chart on your right. You'll see all the things from 2009 to 2016, if you remember, corresponds to Obama time. So during Obama time, you notice that prosecution of CSEC cases went up. So this prosecution of, I would say, human trafficking cases in general and CSEC cases in particular depends on the policy of the moment, on the policy of the president. And when you look at the table one here, criminal prosecution, you see, for example here, percent change from previous year, I'm talking about 2018, goes down. And percent change from 5 years ago up to 2019, less than 30%. All this was in time of Donald Trump. Yet, something you can see there is that over 10 years, there have been 91% of increase in overall prosecution. But during the time from 2017 to the end of Donald Trump time, it is going down. And you will remember the case of Jeffrey Epstein. This relates to that a lot. These are some cases showing you that there is a problem. The good thing is that the transactional records assess clearinghouse in Syracuse University did a wonderful job trying to track. So why are we having such a decrease, even though the number of cases of CSEC crimes are increasing? So they said that it has to do with the policy of the moment. For example, they said that if you look, as I said before, the blue on the chart, the figure on the right, the blue part, Obama time, and when Trump came to power, he decided just to change the priority. It's no longer a priority of the US government to do anything. So track at Syracuse University, they said, for example, that the 94 federal prosecutors in the US generally follow broad administration enforcement policy. So most of the time, statistics you are seeing about the CSEC prosecution, okay, reveal, I'm quoting, what an administration is trying to achieve. So often law enforcement agencies bring forward cases for the prosecution to work on. This kind of teaming up is what is most indicative of a president's criminal justice priority. And track claims that these statistics reveal what, as I said before, an administration is trying to achieve, which is what you can see there clearly there. So what this reveals? So what? It means that what we have been seeing from 2001 to 2019 regarding statistics for cases of trafficking prosecuted is highly biased. The problem is that for people who are researchers in academia, they are not able to assess the data, the same data that I have just shown. And by the way, the people who did these reports, none of them are in academia. They all work in DOJ. So it will be good to have academic researchers have access to those data and analyze them in a neutral way. And thanks to Obama time, we have started seeing a shift, and we hope that with Joe Biden, we can go back and see the real face of prosecution of human trafficking in the US. I will stop there as a brief because I have not gone too much in detail. So I will be happy to answer questions because of time. Thank you.
Thank you, Charles. I know we are at time, but I do want to, if members' schedules allow, if people would like to stay on the call and do any question and answers or a time for discussion. And Charles, I would ask you to stop sharing your screen and maybe we could see each other in, if you could stop sharing your screen and then we could see each other in the grid format, if just for more.
Right, let me see. Okay, I'm trying to do it now.
But if anybody does need to leave and they have questions, they can email them to me and I can get them sent out. So does anybody have any questions about whatever the panelists have presented? I know it was a lot of information in a short period of time. Like I mentioned, I will be sending out the handouts and the resources later today along with the link. So you can learn more, but open it up to comments or questions that anyone has.
Hi. I want to thank all the presenters for taking a good time to research those topics. They were all the topics that have been spoken about today have been very enlightening, and I have begun to even see some light from most of those topical discussions. From how to go further from some of those things that have been spoken about. However, I would like to start from the last presentation, the Dr. Charles, and having practiced law enforcement myself for around close to 15 years now, and having investigated a lot of human trafficking cases, both at local and at international level. I have come to realize that what Professor David said and what Professor Charles said are very, very salient, are reflective in the way we carry out investigation. In that, most of the time when we have combination of those who are economically buoyant, high-ranked citizens commit the same crime with cronies who are lesser. At the end of the day, those who are lesser take the fall. Even when they are willing to confess, when they are willing to give all the details, those who have economic means, those who are high flyers, those who have means, those who are well connected, they get away with crime. So this is most of the things that we've all known for so long, that maybe except if there are some political or economical means involved, those who are higher hardly go down with the crime of human trafficking. It is all those who are, if sometimes even those in some cases handle a particular case in France, where even a victim of human trafficking have to take the fall. She was trafficked from Africa to France. At the end of the day, she had to take the fall as a human trafficker because there were some economic buoyant people involved in the same crime. And also in my own state, Nigeria, we have a lot of well-connected politicians who have been, pointed in cases of human trafficking. However, they don't even, in fact, where they are coming, they are given like a red carpet welcome, So this is the same everywhere. And I think the way out of it is what we are doing. There's need for us to call the attention of, through research, to call the attention of the people, government, through policies, through laws, to change these dynamics. I think this is just this is a lot of responsibility resting on the shoulders of researchers, and I think this is just a good start to focus on this challenge. Thank you very much, everyone.
Yeah, I have a question for David. David, you said that human trafficking is mostly or primarily related to poverty.
That's one of the risk factors. There are many, yes.
Okay, but it's the top one.
Yes.
Yeah.
Best predictor. Where you find more poverty, you find more human trafficking.
Okay, yeah. So do you think that education, despite if you are in poverty and you are educated, can you say that someone highly educated but who is in poverty is at risk of, is as high risk of human trafficking?
We didn't see education as a risk factor. We did see poverty. So it seems that race, poverty, there are well-educated people who are still in poverty. The traffickers, they know where to look. They know where to prey on people. So I can't see evidence in the data for getting more education that doesn't address poverty. Now, if the higher education can take you out of that poverty situation and out of those targeted zones, then it's going to have an impact. So education will work, definitely, but only to the extent that it is targeted at that poverty situation.
Yeah, because most studies said, okay, to get children out of human trafficking, sex trafficking, then we need to give them education. They need to get education. But at the same time, some of the studies I have done show that most of the children in my studies were educated. And when I reported that, stakeholders say, no, you need to remove that from your findings. Because if you keep it,
The
founders
statistical
will not like
analysis
that.
agrees with you, sir. The statistical analysis agrees with you. Education did not pull up as a risk factor. If education can change one of those other factors, yes. But unless it does, I did not see education plus or minus.
Okay, thank you.
We found the same thing that you did.
That's very interesting. Any other comments or questions?
I'll just share really quick, as you said, that's interesting. I just happened to be teaching a class on classism last night, and education and poverty are not necessarily correlated, in that we have very little social mobility within this country, regardless of attaining education. And so we still see high poverty and living well below what we can consider middle class in this country, even when people are attaining higher education. And that's also then correlated with race and gender. And so all of these overlap significantly within our social structures. And I think, as David was talking, this idea of race being intertwined, I just wanted to maybe say from my perspective that I would say it's racist systems and it's racist institutions that are predictors of these things, as opposed to race itself being a factor in the outcomes.
One important thing, let me jump off on that real quick. We saw in the statistical analysis of public health study risk factors. In the risk analysis, we found Gini index. We found income disparity. Apart from education, Gini index is a much better indicator, sort of a reverse indicator of social mobility that you were just talking about. It works against social mobility. When the haves and have-nots are further apart, social mobility is much less possible. Education will have less of an impact, and that a higher Gini index is associated with the lack of social mobility. That is a driver that you were talking about.
Marieki in the comments just said that she has to go, as she is in the UK and it's getting late there. Do you want to say your comment before you have to go, or okay?
Yeah, I will. I typed it in there, but recently I was in a conference where someone remarked on the triple curse of Africa. My studies were conducted in South Africa. And what I learned really, what our presenters have brought really resonates with my findings as well. And the triple curse of Africa, being a child, being a woman, and being Black, I was actually wondering, just listening to you, and mostly based in the US, etc., which is probably not the same, and yet I hear the similarities. And I was wondering whether that curse is a global curse more than an African curse. So that was just my little comment, and just to say thank you to the presenters. It was my first webinar, so I enjoyed. Thank you.
I'll comment really briefly. There's some of the literature that I pulled from addresses racial hierarchies and pigmentocracies, and the underlying aspect there that relates to what you're asking, whether this is US or global. While race has developed uniquely in the US, anti-Blackness and pigmentocracies are global. And so that aspect of othering based upon phenotype and sometimes ethnic group, and some people might call those tribal groups as well, is a global phenomenon as well. And so I think you're absolutely spot on to connect the two of those.
Let me add one quick comment on that. In this kind of the study that I did, there are some things that this study can't see, and gender is one of them. Now, the way this study works is Oh, you got more Gini index, you got more human trafficking. Check that box. You got more, you have more education. Does it correlate with more? Nah, up and down. But it can't find gender because there isn't a place that has more women than men relative to other places. It's about 50% anywhere you look. And so this kind of study tends to naturally be blind to gender. It can't tell one way or another. We know that it's part of that triple curse. I'm just saying that this particular study, it found the other factors. It didn't find that one, but it wasn't able to see that one. We all know from personal experiences working with victims that this is very much the case.
Would someone be able to comment on the triple curse a little bit more? Ezgi had asked in the comments, is this used like as an insult, or who has labeled this term, the triple curse of Africa?
I'll comment on that. Triple curse is if you have any one of these factors, life is going to be hard for you. If you have two of them, it's going to be harder. If you have three of them, it's nearly impossible to overcome. That's why it's the curse. It's not a label. It's not a derogatory term. It's simply understanding the compounding intersecting risk factors. It's about intersectionality and who has the hardest life. And those are three independent predictors. They can all happen to the same people. And if you have any one of them, it makes things worse.
Yes. Yeah. Thank you for explaining that. It's who's at the right at the bottom. Yeah. Thank you.
Thank you, guys. Yes, more like triple disadvantaged. Yes. Wonderful. Well, if there's no other comments or questions, I think we will wrap it up. As mentioned, I will send out the link in the handouts later today. All of the handouts will have the panelists' email address on them. So if you do have questions that you think of and want to follow up with those comments or questions, feel free to do so. I'm sure that they would be more than willing to get back to you on that. So thank you again for joining us today for the February GAHTS webinar, and join us next month for the March webinar on COVID-19, and hear from me for more information about the date and time of that. So everyone enjoy the rest of their Friday and have a great weekend, everyone. Bye.